Today we're talking about the timeless discussion when it comes to Medicare and Medicare beneficiaries. And what is that? That's Medicare Supplement versus Medicare Advantage. This video is designed to help you with no fluff and just straight education and facts on both sides, how they work, and how they may be able to fit into you and your situation, and how they may be able to fit into your healthcare overall. If you're watching this video, you're probably getting phone calls, you see mail, a lot about Medicare Supplements, Medicare Advantage. What does that really mean and how do they both really work? So we're gonna start over here, which is gonna be one of the most common ways to get your Medicare and your insurance through Medicare, which is gonna be original Medicare. So that's gonna be your Part A and your Part B. When you get Medicare and when you sign up for Medicare, you're gonna have a red, white, and blue card that has your name. It has an 11-digit Medicare number unique to you, and it's gonna say Part A, hospital insurance, and it's gonna say Part B, medical insurance. So that's what this reflects right here. And when you have just A and B and no other insurance, there's a lot that goes into it, but the biggest thing you need to be aware of is you're going to be responsible for 20% of any medical costs with no limit. Okay, so there's a few different options to really cover up those exposures. The first one is what we call a Medicare Supplement, or it's also known as a Medigap plan. So when you're looking at this picture here, really think of this as different cards that you're gonna receive when you have this insurance. So this is gonna be your Medicare card, Part A and Part B. This is your Medicare Supplement card. And then when you have this option, additionally, you will need a standalone prescription drug plan, or that's also known as Part D. Now, the thing I really wanna focus on, and we're gonna come back to this slide, but the thing I wanna focus on with Medicare and Medicare Supplements are really the pros and cons and how it functions as a whole. So when you have Medicare, original Medicare Part A and Part B is your primary insurance. So what exactly does that mean? Well, the first thing you need to be aware of is you have no network. So you can go see anybody in the country, any doctor, provider, hospital that accepts original Medicare. And as of right now, that's about 98% of doctors and hospitals across the country. So if you live just like here in Tennessee, you can go to California. If you live in California, you can go to New York. As long as they accept original Medicare, you can go see those providers in those hospitals. So there's no networks, there's no restrictions on that. You do not need referrals when you have original Medicare as your primary insurance. So those are all huge benefits. Another thing that you're going to hear me talk a little bit about today is what is called prior authorizations. So when you have original Medicare with a Medicare Supplement, for most services in most states right now, you do not need any prior authorization for most services. So in a few states right now, they do have a pilot program where you may need prior authorization for durable medical equipment and things of that nature. But for most services right now, you do not need any prior authorization. So when it comes to Medicare with the supplement, what people are really looking for and what people really like with that and what attracts Medicare beneficiaries to this is you're getting freedom, flexibility, and you're really in control of your healthcare decisions, who you can go see, where you can seek medical advice from. And along with that, there are a lot of you watching this video, you may be familiar with some places such as the Mayo Clinic, maybe MD Anderson down in Texas, could be the Cleveland Clinic. So a lot of different facilities like that, they are going to accept original Medicare. So when it comes to those networks that we're talking about, if you really want flexibility and freedom in choosing your providers and where you get medical advice from and medical treatments from, Medicare with a supplement, you will find nothing better than that when it comes to those choices. So biggest things to be aware of when it comes to Medicare supplements. So the first thing, a lot of people aren't aware of this, but Medicare supplements or Medigap plans are federally standardized. So really what that means, most common plans today, Plan G, Plan N, let's just say I get a Plan G with company A, and then there's a Plan G with company B, C, or D. Those Plan Gs are exactly the same coverage The only difference between them is the premiums that they're charging you. So the coverage is federally regulated, federally standardized. So Medicare supplements, Medigap plans all across the country are going to be the same. There's a few states where it's a little bit different. That's Minnesota, Wisconsin, Massachusetts. If you're in one of those states, it works a little bit different on that front, but everywhere else, Plan G and Plan N are federally standardized. So super important to understand that. Some other things to be aware of when it comes to Medicare with a supplement. Dental, vision, and hearing. That is not going to be covered by original Medicare or your Medicare supplement. So a lot of people think, oh, okay, I'm gonna get Medicare and a supplement, and it's very, very good comprehensive coverage, but it does not cover dental, vision, and hearing. So if that's something that's important to you, that is going to be something that you need to add in addition to that. So other things, when it comes to Medicare with a supplement, if I really had to break it down, you're going to pay a little bit more for this option, but you're gonna have very, very low out-of-pocket costs. And really what I mean by that, the biggest thing you should see is what's called the Part B deductible, which in 2026 is $283, and then all other Medicare approved expenses are gonna be covered after that. So it's very, very good coverage. If I had to pinpoint one downside to it, it's gonna be a little bit more expensive, and you can and will see rate increases on those every single year. So again, very, very good coverage. It's a little bit more higher premiums, and you do get rate increases on that. Overall, if I had to recap that, you have no networks, you don't need referrals, you don't need prior authorizations for most major services. They're gonna be federally standardized, so Plan G with one company is gonna be the same Plan G with any other company out there. And then it's gonna be very, very comprehensive coverage, just a little bit higher premiums and rate increases on that. So that's Medicare Supplement. Let's talk about Medicare Advantage here a little bit. And again, one of the things that you're probably seeing a lot, whether it's in the mail, you're probably getting phone calls on this, you probably see TV commercials on this, is Medicare Advantage. So what exactly is that and how does this function? So the first thing, Medicare Advantage is also known as Part C. So really, what does that mean? A private insurance company comes in and they combine your Part A, your Part B, and your Part D, and they mash it all together and they call it Part C. So all of your coverage is on one card with one company, and that company manages your Medicare. So there's some pros and cons to this. And that term, managing your Medicare, that scares a lot of people. And there's just some things that you really need to be aware of when it comes to Medicare Advantage and how they manage your Medicare. So again, a private insurance company combines your health insurance and your prescription insurance all together on one card with one company. So this managing thing, what does that mean? The first thing, if you think back to original Medicare, you have no networks. With Medicare Advantage, you do have networks. So there's a few different network types that are out there with Medicare Advantage. The two most popular that you will see is what's called an HMO, Health Maintenance Organization, and what's called a PPO, which is a Preferred Provider Organization. So there's some key fundamental differences between the two and that you should really be aware of. So the first thing is what's called an HMO, the Health Maintenance Organization. If I had to really simplify this, other than an emergency, your doctors and your hospitals need to be in that plan's network. So if you have an emergency and you're not in the area, that will be covered by your HMO plan. But other than that, your doctors and hospitals that you see on a daily or weekly, monthly basis, they have to be in that plan's network. And most HMOs today do require a referral from your primary care physician. So if you, just an example of that, if you may not know what a referral is, if I needed to go see, let's just use a cardiologist as an example, I need to go see my primary doctor. They need to see me, give me a referral to go see the cardiologist they want me to see. I don't get to pick that specialist, okay? A PPO, the Preferred Provider Organization, it is designed to give you a little bit more flexibility and a little bit more freedom when it comes to networks and provider availability. So there's some things to really be aware of when it comes to PPOs that a lot of people do not disclose when it comes to Medicare Advantage PPO plans. So we're gonna talk about that a little bit, but what a PPO is designed for, that's different from an HMO is you have an in-network availability and you have an out-of-network availability. So typically your cost sharing, your co-pays, if you stay in the network, are gonna be a little bit lower with that PPO plan. If you go out of the network, it's gonna be a little bit higher. But the biggest difference with a PPO plan is you do not need that referral when it comes to your primary care physician for specialists. So you have a little bit more flexibility and control to pick different providers that you want to see without having a referral from your primary care physician. Now, let's go back to talking about the out-of-network thing. So this is one thing that a lot of people do not talk about when it comes to Medicare Advantage PPO plans, and that is if you decide to try and go out of the network with your PPO plan, and this does matter a lot based on what state you're in, but if you have a PPO and you want to go out of network, you need to make sure that your doctor that you're going to see will agree to bill your plan out of network. So a lot of people forget to mention this or don't mention this when they speak to Medicare beneficiaries. They come to find out the provider is not going to build a plan, they're out of network, they have to pay 100% of the costs, and then this is where a lot of the Medicare Advantage can get some bad reputation to it because there's some disclosures that people don't mention to the client. So that is super important that you're aware of the distinctions between HMOs and PPOs and how they're built and how they function. So that's just one thing with Medicare Advantage. Networks, so that's super important. We have to make sure your doctors and prescriptions are gonna be covered by that plan. The second thing is prior authorization. So if you remember back to original Medicare, for most services in most states, you do not need any kind of prior authorization for those services. When it comes to Medicare Advantage, you do have prior authorization. And there's a reason for this. So if you think that there's really two reasons why prior authorization exists with Medicare Advantage. So the first one is what most people think about when it comes to Medicare insurance and why they have a prior authorization is it is a private insurance company. So before they cover a major service, they want to make sure that it's medically necessary and something that you do need to have when it comes to that care. So that's the obvious one. The second reason, so when it comes to original Medicare, there is a lot of fraud, waste, and abuse when it comes to the funds in the Medicare industry. So the prior authorization process when it comes to Medicare Advantage is to help with a checks and balances system with the fraud, waste, and abuse in that, and there are studies that show that it does decrease the amount of fraud with that. So those are the two main reasons for prior authorization. So you need to be aware of that. When you get Medicare Advantage, there's networks, you have prior authorizations, and just a statistic from CMS. So CMS is who runs and manages the Medicare program. In 2025, 95% of all prior authorization requests that went out in the Medicare Advantage program, 95% of those were approved on the first request. Out of the 5% that were denied, they do have an appeal process. So 80% of that 5% that was denied were overturned on the first appeal process. So out of all the millions of claims that were sent in for approval, it was a very, very small amount that were ever denied. So just more information on how that works with networks, prior authorizations, more information to just be aware of. Other benefits when it comes to Medicare Advantage, you're gonna have lower monthly premiums overall, and they do come with some additional benefits like dental, vision, hearing. You may have heard of Silver Sneakers, Renew Active, different fitness benefits like that. Long story short, that's gonna be a free fitness membership for you. There could be things like over-the-counter benefits, which is for vitamins, minerals, first aid items, anything like that. And if you're hearing what I'm saying right now, you may be thinking that they're giving you a lot of benefits. Why are they doing that? And that's really because the Medicare Advantage program as a whole is designed to help have a more proactive approach when it comes to your healthcare. So you're gonna have lower monthly premiums. They give you some additional benefits, the gym benefits, the over-the-counter benefits. They give you those because they want you to utilize that, and they think if you have and use those benefits more, in turn, you're going to the doctor less, you're going to the hospital less, you're sick less, so you're going less, you're healthier. The healthcare insurance company is spending less on your healthcare claims. That's why the Medicare Advantage program is designed the way that it is it's designed to help you be more proactive in your healthcare. So that's the Medicare Advantage program as a whole, how it functions, how it's designed. Now one thing to be aware of, again, when it comes to Medicare Advantage, so you're gonna have a lower monthly premium, but you will have higher out-of-pocket costs and higher co-pays. So for things like specialist visits, hospital stays, surgeries, different, physical therapy, you pretty much have co-pays for a lot of different services. Now you do have a maximum out of pocket. That's gonna be the most that you could be billed in a calendar year. So those are some major things to just be aware of when it comes to Medicare Advantage. Now, if I had to recap this as a whole, so Medicare supplements versus Medicare Advantage, with Medicare and a supplement, you're gonna pay more on a monthly premium, but you have much more flexibility, more freedom. You don't need referrals, no prior authorizations, and you're gonna have very, very comprehensive coverage. When it comes to Medicare Advantage, you're gonna pay less every single month, but you now have networks, you're gonna have a prior authorization process. You do get some additional benefits, but with that lower monthly premium, you do open yourself up for a little bit more exposure and co-pays that you need to be aware of. So the biggest things when it comes to deciding and choosing a Medicare plan, you just need educated on both options, how they both work, pros, cons, benefits of both, and then finding the best option that fits your specific situation.